Hi, I'm Dr. Chad Watkins with Watkins Foot and Ankle Clinic located in Leesburg, Florida. And today I wanted to talk about ingrown nails. So often people will have trouble with ingrown nails due to heredity, and they'll have that their nail starts to curve or incurvate. And as the nail grows out, it starts to dig into the skin, and it can cause a buildup of skin that we call proud flesh or a paronychia. And as it digs in and it causes pain and discomfort, it can become infected. And so often we have to do a procedure. So there are two different types of procedures that we can do. One is a temporary procedure where we just remove the nail. The other is a permanent procedure where we put a little acid on and kill the nail so that it shouldn't grow back. And we're essentially giving someone a chemical burn. Either way, you have to do an injection to numb up the toe. So what I tell people is if you've had the problem over and over and over again, you probably want to do the permanent procedure so that you won't have a problem again in the future, since you're going to go through the pain of the injection anyway. So when we do the injection, we numb up the toe back here. And it's a stick and a burn. I tell people it's like a bee sting. Some people say that it's like the whole hornet's nest. So after we've numbed up the toe, what we'll do is make a incision along the toe where we basically just split the nail, and then we'll remove the nail with hemostat or something to just kind of pull the nail out. And then we'll use little Q-tips, kind of wooden sticks, to put some acid on, which is called phenol, back by the nail. And that kills the cells back at the back of the nail that produce the nail. And so essentially you just have a little thinner nail, and it removes the two sides of the nail where it's digging in. Or if only one side is bothering you, we can do one side. It's a very simple recovery after the procedure. You just soak your foot twice a day in betadine mixed water. Clean the nail groove with warm soapy water or alcohol, and then apply Neosporin and a Band-Aid. So you do the soaks for 3 days, and then you just continue putting on the Neosporin and a Band-Aid. I tell people you can't go swimming or take a bath after the procedure, but you can take a shower. You just hold the foot out of the dirty water. You don't want to be standing in the dirty water and get it infected. And that's the biggest concern with the nail avulsion, is infection, things of that nature. So it will bring you back in a week to make sure that it doesn't look infected. That's included with the price of the procedure. It's in what we call the global period. And then we'll bring you back 3 to 4 weeks later, and it should be healed up. It usually takes 4 to 6 weeks for the nail to heal. Now sometimes if the nail is giving you problems, you can remove the whole nail, but we'll only do that if someone has severe fungus and it's giving them sores and infections or problems and pain. And what I tell people with that is you're trading off a thick nail for some callus, because without the nail, the skin will tend to callus over. You don't really need the nail, but I tell people you really want to do that only as a last resort. But usually it's just a simple procedure like I showed here, where we remove the two sides, takes care of the ingrown nail, and then you don't have to worry about it anymore, because what people will find is they've been angling their nail back, or going in to see the nail technician, and it keeps coming back over and over again because it's the way that nail curves and it grows out and digs in. So we're just trying to remove the side so that it can push past the skin and not give you any pain anymore. So if you have ingrown nails or any problems, give us a call at Watkins Foot and Ankle Clinic in Leesburg, Florida, 352-805-4317. Thank you. Bye.